Hello everyone, my name is Nadira.
My name is Farah.
My name is Zahira.
And we are from School of Pharmacy ITB, and today we are going to talk about the roles of prokaryotic cells in pharmacy.
So what are prokaryotes? Prokaryotes are unicellular organisms that lack nucleus, organelles, or any other membrane-bound structures. For example, bacteria, archaea, and cyanobacteria. The advantages of using prokaryotes is because of its simplicity in its structure, its fast reproduction in large quantities, its fast adaptation, its diverse metabolic system, and its ability to pass on adaptive genes. The roles of prokaryotic cells is as a source of protein. It can be therapeutic or non-therapeutic, like drugs or vaccines. It is also a source of antibiotic. It also aids in diagnosis because it can diagnose the cause of your infection and it can identify the best way to treat the infection. The next one is biological factory. Many important drugs, like antibiotics, are natural products that are built up by prokaryotic cells like bacteria, and these natural products will then be modified to get the desired drug. And the next one is microbiology analysis for product or process quality. This is required and necessary for contamination detection and to maintain high quality products. And the last one is as a source of cosmetics.
We see that from the definition of prokaryote before, one of the examples are bacteria. And you might be thinking, but aren't bacteria supposed to be bad? Well, there are both good and bad bacteria all around us at any time and anywhere. We can also transform and or modify those bacteria into something that can benefit us.
Let me tell you a little example. Let's say someone suddenly felt numb in every part of their body. Their head hurts, and in a second, they lay motionlessly to the ground. No, they're not dead. You'll take that person to the hospital with a high-speed ambulance because this poor person may potentially have stroke, and stroke needs to be treated fast, no minutes wasted. After getting through several stroke check-up procedures, if the patient suffers from blood clotting, the doctors and nurses will administer some drug to break those clots. Those drugs are called TPA drugs, or tissue-type plasminogen activator. In particular, the patient will be given a streptokinase injection to ease their side of stroke. In conclusion, a thrombolytic drug to dissolve blood clots and ischemic stroke patients are administered 40 minutes after being admitted to the hospital.
There are two types of strokes. The first one is the most common one, which is called ischemic stroke. This ischemic stroke happens when the blood flow through the artery that supplies oxygen-rich blood to the brain becomes blocked. These blood clots often cause the blockages that lead to ischemic strokes. And the other type is called the hemorrhagic stroke. This happens when an artery in the brain leaks blood or breaks open. The leaked blood puts too much pressure on the brain cells, which then damages them. And the type that we will talk about today is the ischemic stroke.
Streptokinase. Streptokinase is naturally produced by Streptococcus as the bacteria. It is an extracellular protein extract from certain strains of beta-hemolytic Streptococcus. It is the most widely used thrombolytic agent and can now be made using recombinant DNA technology. It is used to dissolve blood clots that have formed in the blood vessels. It is used for stroke treatment. This medicine may also be used to treat blood clots in the lungs, or pulmonary embolism, and in the legs, or deep venous thrombosis. Streptokinase can only be used for ischemic stroke. This is the picture of streptokinase, with the right one being the crystal structure. Now let me tell you about the source of the streptokinase, which is the bacteria Streptococcus itself, or Streptococcus. The genus Streptococcus belongs to the family Streptococcaceae. They are spherical, chain-forming gram-positive bacteria, and the cell division in streptococci occurs along a single axis. So as they grow, they tend to form pairs or chains that might have appeared bent or twisted. So they will form a long thread.
So, how does streptokinase actually work? Well, firstly, the clinical importance of streptokinase was first noted by Tillett and Garner, which also discovered that this bacterial protein caused the lysis of human blood clots. And it was also found that streptokinase is not an enzyme, but rather a pone activator of plasminogen, the inactive precursor of plasmin. So, what are the working steps of a streptokinase? Well, first, it will bind to the plasminogen. It will result in conformation change, an exposure of an active site, and lastly, activation of additional plasminogen. So, if we explain it through the picture beside it, we see that plasminogen is activated by the plasminogen activator, which in this case is streptokinase. So after the streptokinase activates the plasminogen, it will turn into plasmin, and plasmin will incite fibrinolysis, which is the degradation of blood clots. So now we will see the characteristics of streptokinase. But firstly, we need to understand that TPA drugs are divided into two subtypes. The first type is fibrin-specific plasminogen activators, which only works at a specific area of the body and breaks down only the problematic blood clot. Second type is non-specific plasminogen activators. Like the name suggests, it does not specify the area and breaks down blood clots, including the normal ones in the body, which are not harmful for us. So, which type is streptokinase grouped into? Well, streptokinase is grouped into the non-specific plasminogen activators. Streptokinase does not specify the area and attacks the blood clot as a whole, so it should not be given to a patient who took the medicine within the last 6 months, because it will create an allergic reaction and it might be fatal to the patient. And we should also note that this drug is prescription only and should only be administered by a professional paramedic.
Here are the steps in production of natural streptokinase. This bacteria will go to bioreactor and it will multiply. Then it will be taken into an even bigger reactor to continue its growth process and multiply even more. This will be repeated for several times for a few weeks until there are enough cells to go to the next step. The next step is protein isolation, purification, and characterization. After we harvest the contents from the bioreactor, there will be therapeutic proteins and other proteins and other substances. This will be taken into special filters to eliminate the unwanted compounds, and then we will obtain only the purified proteins. And the next step is formulation process. And the last one is to meet the quality, efficacy, and safety requirements. This will undergo strict quality control to provide safe and effective treatments for the patients. Each bottle will be inspected individually for any irregularities.
From all the information that we have explained previously, we now know that not all bacteria are bad. It can also be useful for humans if we modify them. Streptokinase is one of the examples of the roles of prokaryotic cells in pharmacy. And lastly, streptokinase is used only for ischemic stroke and not the hemorrhagic kind. Here are the references that we have used in this video.
So that is all from us regarding the roles of prokaryotic cells in pharmacy, and we hope that you can find this video helpful, and don't forget to like,
comment,
and subscribe. Thank you.